Welcome to Facebook Live. I'm Dr. Paul Vanek, and I'd like to introduce to you truSculpt Flex. This device is the first of its type in Ohio. We're having an introduction today with one of our beautiful model patients who I told her I would not disclose her identity. So she's having the 16 treatment heads applied to her body in order to clinically improve her strength, firmness, and tone. We can treat the abdomen, the buttocks, and the thighs, including the biceps. We don't do the pecs or the lats, but we can use this device called truSculpt Flex in order to take a person who's already in good shape or take a person who's in not the shape they want to be in and really personalize and select for their fitness level, the shape they're in, and their goals. There are eight groups that can be utilized in one session. As you see, this is an array that's software based. We tune the electrical stimulation to the muscle directly, and in order to do that we have to first select the treatment modes, and there's 3 treatment modes. So depending upon the shape you show up in, whether you're very highly tuned and toned or whether you're just trying to get off the couch and look better, you can come in and have a truSculpt Flex treatment. The treatments are typically done in the office. They're non-surgical. It's a way to make your muscle groups get stimulated and be tighter. The sessions are about 45 minutes each. We usually do 2 sessions in a week and then 2 sessions next week. And then if you want to maintain the gains you get, we tell you to come back once a month and have a subscription service. But 4 sessions will make a substantial difference in the way your body looks in the mirror. The way this works, it's called multi-directional stimulation. If you look at these devices, they're set up going into the electrical machine. The low levels of energy achieve a deep and full muscle contraction at the highest intensity. If you notice her, she has a little quiver to her muscle groups. That low energy is using a proprietary handpiece. We apply this with a little gel in the tummy. It's comfortable, doesn't feel cold or hot. The person has very safe and consistent results. So we're able to customize the energy delivery based upon the individual person. So me has a little more fat, or a woman who's got a little less fat in her layer, she can have this dialed in that makes her very comfortable. The 3 treatment modes are essentially prep mode that acts, for example, in the trunk like a twisting or warm up to stretch the muscles and build a tolerance to the contractions. If you're already in a very fitness, like I do some yoga now, so I'm much better in tone than I was a couple years ago, that'll hold the muscles to the point of exhaustion. Then it relaxes to increase the strength and enhance the endurance of the muscle. Then the sculpt mode is for those patients that are much more in shape. They really want to tune up their body appearance in the mirror, in a photograph. That's for fast twitch or sequential contractions of the muscles, and that really builds the muscle mass. It also increases the basal metabolic rate. I can really tell you, when I had this treatment, my heart rate was not super high, but it elevated from my baseline in the 70s to about 110 for about 6 hours. So you really know you got kind of a workout that happened at that time. So the way it works, it's a very intuitive thing. We work with the screen, we talk to you. Now she's already set and she's comfortable. If the person on startup has a little bit of twinge in their muscles, we just give them a little ball to squeeze. But what I've seen is that the patient can have their buttocks get enhanced. We put this in the upper buttock and really tune up the buttocks. We've seen the torso get that V shape that occurs in the midriff. You can see the muscles tighten. You can feel your obliques tighten. A woman or man who wants to have biceps development, we can really demonstrate their results. When we look at a person who's fit, who says, look, I'm working out a lot and I really want to get that next ripped level, we put this on the person. We do 4 treatments. We let 8 weeks go by. It looks great. We let 12 weeks go by. Their regular workouts are being performed without interruption, and their muscle groups are looking very impressively improved upon. If you go to my website, Mentor Plastic Surgery, you're going to see some truSculpt Flex device outcomes that my patient cohort is already enjoying. What you see with a person that may have a bit of pooch in their abdomen because they may not be as toned as they are, they just essentially, they look like they've sucked their muscles in, their side abdomen comes in where we treat the obliques, their upper buttocks are tightened. It actually helps with what's called the lordosis here in the back, where the buttocks are developed with the flexion device that occurs. When we look at actual science for this device, we can take an ultrasound and measure the thickness of the muscle dimension, and then we can look at the different layers of the muscle right through the abdomen skin, and we show that those muscles have actually developmentally gotten larger, and they're measurable and they're photographable. So a woman who says, I'd like to tone up, I don't want liposuction, I don't want to do anything outside besides the gym workouts I'm doing, I can put her for a series of 4 sessions on truSculpt Flex and have a substantial improvement in her appearance. Now that we are in the world of I want a Brazilian butt lift, that requires taking fat out of your body with a liposuction surgical technique, transferring it into the 3-dimensional buttock region. But with truSculpt Flex, I'm able to enhance the muscles. You see people who are skaters, you see people that are doing squats. If they don't have the knees for the squats, they're not going to get that kind of buttock enhancement. But now that we have truSculpt Flex in my practice, I'm able to have a person who's already pretty happy with their situation, but they want to have an enhancement, and they can pursue that. When I combine this in my practice with truSculpt ID, I can take somebody who has poor skin quality and I can reduce their fat, I can tighten their skin, I can do comprehensive body sculpting with truSculpt Flex. Now I'm able to actually tone their muscles and take that loose abdomen and really tone it up and make it much more fit appearing. So I do have an ability to provide a person now in menoplastic surgery with non-surgical opportunities to improve their body habitus, make their muscle function better, enhancing what I'm seeing, for example, at Health Mac with Max Strength Fitness. I'm working out at Max Strength twice a week. I'm certain that I'm going to have better workouts when I apply this energy to my circumstance. I'm doing yoga now. That means I'll be able to do better planks and better upper extremity work and have better core strength because of my enhancement with the truSculpt Flex intervention in my life. So my practice is introducing this. I'd like to welcome you to join me at Menoplastic Surgery. You can click or follow me on Facebook, and it's great to talk to you.